I'm Mark Crabtree. I'm a neurosurgeon at Cox Health, and I'm basically involved in neurosurgery for spine problems and brain problems. Went to the University of Arkansas in Little Rock, and that's where I went to medical school, and then stayed on for internship in general surgery and 5-year residency in neurosurgery. Typically, as far as the work comp arena is concerned, I'm involved in spine surgery of various sorts, sometimes peripheral nerve surgery, for the most part, I'm what you might consider a general neurosurgeon, which just means that I would operate in the brain as well as in the spine, and probably about 80-20% as far as the split between spine and brain goes. You know, I think neurosurgery has an opportunity basically to intervene in most any part of the body. So as far as operations go, it's fun to be able to know the anatomy in most parts of the body and be able to surgically operate in that respect. As far as what do I like most about neurosurgery, I think that people who are in pain many times want to be relieved of that pain, and it can be quite severe from a nerve pinch or some other problems. And so for me, the ability to relieve pain and do so in a technically satisfying way, in other words, the technical aspects of the surgery is pretty neat stuff. You get to operate next to nerves and in the spine, in the brain, different places like that. So it's a lot of fun in that sense. Neurosurgery, when I first encountered it, was in neuroanatomy, which is one of the harder classes in medical school. So it represented a challenge for me, and as such, I sort of became hooked on the whole idea of operating in the nervous system and doing things that maybe couldn't be done 50 or 100 years before. Neurosurgery is a subspecialty that is typically located in different regions, so it's more of a regional resource. And I wanted to be sure that I was in a practice where most of the patients would at least have the opportunity or feel like they were in good hands if they stayed in the local area, as opposed to some of the smaller practices in community hospitals where neurosurgeons may practice, but many times if there's a tumor that comes along or something, patients feel like they have to travel to the next big city to get care. And I wanted to be in a large enough medical center that I felt like I had the resources and the support in the medical staff to provide excellent neurosurgery care for our patients, and wanted to make sure that we had the option of doing most of that care locally. You know, I think that as we go through life, we grow and we change. And when I first came to Springfield, I had young children that I was involved with, and being their father and raising them. And then as time passed, they grow and get out and do things. So my interests changed. So for a long time, I played tennis a lot and enjoyed that. And now I still like to ride bikes, hike, and do things like that. But I've also developed some other hobbies that I feel like are things that I'll probably do throughout life, things like pottery and stuff like that. So.